My name's Matt Everson. I'm a chest consultant here in Manchester. It's a programme that invites patients aged between 55 and 80 who on their health records have ever been recorded as smoking, whether that's now, whether that's in the past, whether it's long in the past. And they get invited to a lung health check. We send invitations out, they phone up, they make an appointment for their health check, and they have a number of different health checks. When they come through, we look at breathing tests, we look at the risk of having a heart attack or a stroke, and we look at the risk of developing lung cancer. So we do have some calculators and ways of assessing what's this person's individual risk. And if it's above a certain level, we'll offer them to have a CT scan then and there on the truck in the supermarket car park. And by doing that, we've shown we picked out a very high number of early lung cancers with no symptoms. And because it's a very early stage and a very early diagnosis, that's the time when we can offer treatment designed to try and cure the disease. The great tragedy of lung cancer is that it often presents or causes symptoms at a very late stage. Your lungs have little in the way of nerves in them, so you cannot feel something growing to say something doesn't feel right to get yourself checked out. The whole drive behind the lung health checks is to take patients that could be considered at higher risk of lung cancer, that will have no symptoms at all, but go looking for it before it may cause any symptoms. And the earlier we find it, the more treatable it is. It had to stop towards the end of March, at the outset of COVID cases rising very, very rapidly. And that was the moment where there was the real concern that the NHS would be overwhelmed and all resources were being put into that frontline care. We've started our lung health check program again in August, and it's had to change a lot. And just as we do in hospital, we've mirrored many of those interventions. So if someone has a lung health check, they're called the day before, and asked about symptoms. If they are attending a face-to-face appointment or CT scan, the booking systems has changed to spread those out significantly through the day, so that person would be the only person in the waiting room. That there is a one-way system through the truck where they have their lung health check on, and again, all staff and visitors in PPE, in masks, with hand sanitizer when you walk into the truck, every time you move on, and when you leave the truck. With an enhanced cleaning program between every patient in each area of the truck. We've had to stop doing certain things that were part of the lung health check. So the breathing tests is a very forceful breathing maneuver to breathe out into a machine as a maximal effort, and so we just haven't been able to do those. So they've been taken out. So that's been a necessary step. But the program is now continuing. It's back up and running. We're absolutely delighted that it was. There's lots of people coming for their scans. The feedback's been very, very good. That it's reassuring to see how that social distancing is maintained throughout, that all the staff are wearing appropriate PPE, that they have the opportunity to sanitize their hands at lots of steps through the process. All those things are relatively simple things, but are very reassuring. We really, really want them to attend. And that's a lung health check, that's a chest x-ray appointment, it's a CT, it's with their GP, whatever it is. Anyone has symptoms from their chest and they're worried about them, we are here to look after them, to make sure that they're safe. And it just may save a life. There is so much that can be done in lung cancer. Treatments are changing so quickly. Now, what we do today is different to what we did 2 years ago, which is different to what we did 2 years before that. It's changing that quickly. And the earlier we find, if it's there, the earlier we find it, the better, the more that can be done.